There's a lot happening in the news this week with everything from the Supreme Court handing down dozens and dozens of decisions to one of the most iconic comedians and political commentators in the industry, in the world actually, is speaking out about what's going on with Medicare Advantage. And it's quite interesting because he's not even a Native American. Actually, he's from England. And I'm talking about Russell Brand. And what he has to say about Medicare Advantage could not be more spot on. In fact, it will blow you away as to his insight into what's going on behind the scenes with Medicare Advantage. It just blows me away, really. So I'm going to share with you that whole thing in its entirety at the end of this video, so stick around. You will be blown away, again, by what Russell Brand has to say. Whether you like him, whether you hate him, he's got the facts down pat on what's going on with Medicare. If you've not yet watched one of our videos, my name is Christopher Westphal, and I want to share with you, I do all things Medicare. In our office, we help people from coast to coast around the country with Medicare decisions on what to do with their insurance. Today is of particular interest because the United States Supreme Court, in a very rare decision, has spoken out about Medicare Advantage, particularly what's going on with them charging too much money to the government, and in this one particular case, refusing to give that money back to the government, even though the law says that they absolutely have to. So I'm going to keep my opinion out of this, just going to bring you the facts today. My opinion is whatever is best for seniors, and that's not the same for everybody. There's no one particular company or brand or plan type that's best for absolutely everybody. And it takes an independent broker to look out for your interest and represent you to the marketplace, and that's what we do. So in this particular case, the Supreme Court said that they're not going to hear any more appeals, remanded back to the lower court, the appeals court, that United Healthcare did not want to return the money that they had overcharged Medicare. So this is interesting because these insurance companies have been overcharging Medicare for years, and there are some pending litigations coming out of the Department of Justice against these companies for doing just that. So this decision reads, the story on it says, let's see if I skipped one. Yeah, the Supreme Court has declined to hear United Healthcare's challenge to a federal rule stipulating that insurers offering Medicare Advantage plans refund payments based on unsupported diagnosis in patients' medical records. This has been going on for a long time. The rule, which has been in place since 2014, requires that if an insurer learns of a diagnosis submitted to CMS, that's the Center for Medicare and Medicaid Services, for payment, lacks support in the beneficiary's medical record, otherwise known as fraud, the insurer must refund that payment to the government within 60 days. What's the impact of this decision? The overpayment rule is part of the government's ongoing effort to trim unnecessary costs from the Medicare Advantage program. Overpayments to Medicare Advantage insurers is a serious drain on the Medicare program's finances, this guy says. In 2016 alone, audits of the data submitted by Medicare Advantage plans to CMS showed that CMS paid out an estimated, this is 5 years ago, $16.2 billion of your taxpayer money for unsupported diagnosis, equal to nearly 10 cents of every dollar paid to Medicare Advantage organizations was fraud. The larger trend is Medicare payments to the Medicare Advantage program depend on participating insurers accurately reporting to CMS their beneficiaries' demographic information and medically documented diagnosis codes. So they made this law happen, and the insurance companies don't want to deal with it. What they're saying is that there was an unrelated rule in CMS regulations that says that as long as they're doing it based on what the traditional trend is across the industry, it's okay, even though we're ripping off the federal government and the taxpayers over here. The amendment specified a 60-day deadline for reporting and returning identified overpayments and confirmed that such payments not properly returned may trigger liability under the False Claims Act. That's happening a lot right now. There will be news on that coming up soon. So that's what's going on with the Supreme Court case. In this case, United Healthcare is going to return a lot of money back to the taxpayers, which is going to be a very good thing. Now, I'm going to tease this Russell Brand thing for just a second. I'm going to show you just one part of this, and this is about the systemic problem of Medicare Advantage plans charging you, the taxpayer, too much money. And this is
Advantage insurers such as United Healthcare Anthem and CVS Aetna are celebrating record profits in the tens of billions of dollars, said Dr. Susan Rogers, president of Physicians for a National Healthcare Program. Their business plan is simple. Inflate their Medicare payments by making seniors look sicker than they are, then pocket more of those Medicare dollars by ruthlessly denying seniors care. These seniors are very, very sick. We're going to need a lot more money. You're going to have to supplement it. Won't be able to afford to treat them. Oh, yeah, no, you're right. We don't want loads of old people sick, especially the president's really, really old. He's going to need the help at some point. Go on then, give us the money. Right, out them seniors. We're not giving them that money. We need that for the profit. That's a proper racket, isn't it? You artificially inflate the price and then you do not deliver the implicit service. Meanwhile, more than 7 million seniors live in poverty and 7.3 million seniors are food insecure.
Prices are going up. Everything costs more. The Social Security has not caught up with it whatsoever. And then what else happens? For the first time in history, we've had a 14.5% cost increase for the cost of Medicare for Part B. And that's charged to everybody that's either on original Medicare and or has a supplement, or the people that are on Medicare Advantage. Regardless, you have to pay this increase. Now, I put out a video about 6 months ago saying that it looks like this is going to be rescinded. The increase that was based on one particular drug, because it was stupid, it was ridiculous, and the drug has not been proven to be effective whatsoever. So even though the drug did obtain modest approval from FDA, in Medicare, it did not get approval for everybody to take the drug, Aduhelm. So what are they going to do? Did they decide, as Becerra, the Secretary of CMS, said he was going to return that money to seniors? He wanted to, and he directed Social Security, find the way to get that money back to seniors. Did it happen? No. Why did it not happen? This is a time of historic inflation, costing seniors a fortune, and yet they won't return the money that was inappropriately charged to them. Every day that goes by, seniors are paying more for Medicare than they should be paying. And what did they say? They came out and said, that's okay, we'll make it up to you next year. Are they going to pay interest on the money that you're paying too much for? What about the people who had to pay more than the standard Part B because they earned more, or the couples that are paying twice as much as they should be? It's ridiculous. So I have more on that at the end. Make sure to stay to the end of the video to watch what Russell Brand says in its entirety about this increase on Part B and the denial of services on Medicare Advantage. Again, it's fact-based. It's not just opinion. It's pretty interesting. So I want to just briefly, for those who don't know, maybe making a decision about which way to go on your Medicare insurance, or as always, as you should, looking at what options are available and looking at what changes you possibly will make in the future on your Medicare insurance. You have original Medicare, which is something that you've earned your whole entire life, paid into for more than 10 working years. You earn original Medicare Part A. Then you have to get Part B, which is just a percentage of what Part B actually costs. The rest is subsidized by current workers out there. Then you have a choice, because original Medicare, left to its own devices, only covers about 80% of what your bills will be, leaving you with 20% of exposure with no limit on original Medicare is a scary proposition. You could have bills in the hundreds of thousands and have to pay 20% of that. A lot of seniors just don't have that kind of savings to go uninsured. So you have two choices to make: either Medicare supplement, which plugs the holes of original Medicare, or a complete Medicare replacement, which is Medicare Advantage. That's the private plans that Russell Brand was talking about, that was in the Supreme Court case and all that. It's paid for by taxpayer dollars to the insurance company, and their profit margin is the difference between how much money they get from the government versus how much money they pay out in healthcare. Now, a recent video that you can see at allaboutmedicareadvantage.com, that's a website, allaboutmedicareadvantage.com. You'll see there the recent video about the Office of Inspector General's recent study showing that Medicare Advantage plans as a whole routinely deny care to people for one reason, and that's the profit motive. Again, the difference is what they get from the government versus what they have to pay out in benefits. So the incentive is paying out less in benefits, delivering less care. And they do that in different ways, but it's just important for you to see this, because insurance agents, here's the scary part, insurance agents are incentivized to sell you Medicare Advantage plans for a reason. I'll show you that behind the scenes stuff that nobody wants me to share. I'm going to show you what we make as insurance agents when we sell one of these plans. Huge difference between original Medicare and a supplement versus a Medicare Advantage plans. And all my insurance agent friends that are watching this right now are cringing, and they're going to hit the dislike on the video. All the more reason that I ask you to share this video with somebody considering what to do on Medicare, because you're not going to get this kind of information from anybody else. And I know my friends are shaking in their boots right now. I'm going to show you what we get paid, okay, behind the scenes. So on original Medicare, there are no hospital networks. You can go anywhere you want. Same is true if you get a supplement or a Medigap plan. That's probably 90% of what we do in our office is Medicare supplements. Again, we write business from coast to coast, and we have access to all the best plans. We can show you what those are. Our service doesn't cost a dime, by the way. There are no doctor networks. There is no prior authorization required. Referrals are not required either. And supplements you have to pay a monthly premium for. So those you have to pay for. The Advantage plans, generally you don't. Most Advantage plans are no cost to you, the senior. They're paid for by the taxpayers directly to the insurance company. Sounds great until you need to go use it. Again, look at the OIG report on what happens when the sick people actually have to go to use it. In full transparency, we sell both, but I want you to be armed with information, and maybe one is better for you. There's no one plan fits all. On a Medicare Advantage plan, you do have hospital network limitations on the HMO, which is predominantly the plans that are zero premium that everybody wants. There are doctor limitations as well. Your doctor can come on the program and then leave the program right after you sign up for it, even though you signed up for an HMO on Medicare just for that particular doctor. It doesn't matter. The doctor's on a different schedule than you are, and many times they do change their contract, leave, come back, and that kind of thing. Prior authorizations are required. You think you're going to have a CT scan, an MRI, a surgery for your back? No, you're not. You have to get the insurance company's approval first. We have a whole video about that, and the American Medical Association says this is an abomination to hold up seniors' care in pain or close to dying because they have prior authorization requirements on Medicare Advantage. Referrals are required. You want to go see a specialist, your primary doctor must sign off on that first, and they're incentivized to keep you and not send you. And most of them are zero premium per month. Again, that's what most seniors are signing up for. But you have co-payments, and the devil's in the details on the co-payments. Make sure if you're considering a Medicare Advantage plan, as all of our customers who get one are, because we make sure they are, look at how they cover cancer treatment. Cancer is so dominating the senior world right now. The statistics are unbelievable. You probably know somebody who's had cancer or had to fight it, hopefully survived it. It may have even been you, but look carefully at your summary of benefits that are being sold to you on a Medicare Advantage plan and see how much they cover on cancer. We have a solution for that. If you go that route, you can get with our agents in the office and we'll explain to you, but you have to be aware of that first of all. Now that we've gone through the basics of it, there's another story out from the National Committee to Preserve Social Security and Medicare that Medicare Advantage plans are under increased scrutiny. It says in here, and it quotes the Washington Post. Make this bigger so you can actually see it. The irony is that Medicare Advantage plans, which began during the George Bush administration, were supposed to save the Medicare program money. Instead, these privately run for-profit plans are costing taxpayers more money to run than traditional fee-for-service Medicare. According to MedPAC, a government watchdog panel, the federal government incurred $12 billion in excess payments to Medicare Advantage plans in 2020. MedPAC projects the figure to swell to $16 billion next year. Those are excess payments. Again, that's the kind that the insurance company tried to tell the Supreme Court that they don't need to pay back to the taxpayer, but now the Supreme Court has ruled that they do. So now everybody's trying to scramble and find out, where can we find this stolen money that they didn't deserve to get that money back? The Justice Department is pursuing civil lawsuits against multiple companies that participate in the privatized system, from huge insurers to prestigious nonprofit hospital systems. Nonprofit hospital systems sometimes are an absolute joke. You think they're not making profits? Look at the CEO's salary. Look at the salary of the administrators, not the people that are actually providing care, and then come back and tell me that they're nonprofit. Sorry. Little side note, alleging that they have cheated the system for unfair profit, the Washington Post said. The point of larding medical records with outdated and irrelevant diagnoses such as cancer and stroke, often without the knowledge of the patients themselves, was not providing better care. That's not the intention, according to the lawsuit from the Justice Department. It was for higher profit. Medicare Advantage, it continues. That's my graphic on the side. Don't pay any attention to that. Medicare Advantage is on the brink of capturing more than half of the Medicare market, which up to now has been dominated by traditional Medicare. This is thanks in no small part to the torrent of television ads featuring celebrity pitch men, promising lower premiums and free benefits like gym memberships and ride to the doctor's office. Call now, they say. The ads, of course, do not mention that Medicare Advantage plans offer, now this is not my words, this is the words from this organization. The ads do not mention that Medicare Advantage plans offer limited networks of providers, or that medically necessary claims and pre-approvals may be denied so the plans can make more money. Nor do Joe Namath or Jimmy Walker tell viewers that some plans are overbilling the government for false or outdated diagnosis and without patients' knowledge. Instead of being held truly accountable, Medicare Advantage plans are being rewarded in 2023 with an 8.5% revenue increase from the government. Since this privatized version of Medicare was created, for-profit companies have gained increasing influence in the care of one of our most vulnerable populations, the elderly. It is welcome news that the Justice Department and HHS Inspector General's office are intensifying their scrutiny of Medicare Advantage. Finally, we'll see. At stake is nothing less than billions in taxpayer dollars and the well-being of millions of American seniors. So this is a story from the Sheer Post. It says Biden does hike the private Medicare prices, which we all know that's the Part B that was approved by the administration, and funnels profits to private insurers. The largest, this is the story, the largest ever Medicare premium increase will pad the pockets of insurance executives who donated millions to the election. Quote, last week, the Biden administration quietly reaffirmed its decision to enact the highest Medicare premium hikes in history right before this year's midterm elections. At the same time, President Joe Biden is endorsing a plan to funnel significantly more money to insurance companies and further privatize the government insurance program for Americans and those with disabilities, otherwise known as Medicare Advantage. In effect, it says, the higher premium increase will subsidize the larger payments to and profits for private insurance corporations. And if you don't believe me, and if you want to see the quote for yourself, you can go to that link right there. And since it's on the old YouTube, you can pause it and type that in. And actually, you know what? I'll put it in the description of this video. So when you want to click it out and look at the description, you'll see all the records of all the resources that I've put together for you. It goes on. The Biden administration announced on May 27th, just a few weeks back, that due to legal and operational hurdles, they've got legal and operational hurdles over there. You can't hold it against them for taking your money and taking it on direct deposit right out of your Social Security check. You just got to let that be. As they say, don't get upset about what's going on in the economy. It's just operational hurdles that they've got with your money over there. Medicare recipients won't see their premiums lowered this year, even though that rate was originally hiked last November, in large part due to the projected cost of paying for a controversial Alzheimer's drug that Medicare now says it will generally not cover. It's your money. They're keeping it. The administration's announcement comes as Biden officials move forward with a jolting 8.5% hike in payments made to private insurers operating Medicare Advantage plans next year. Again, there's the resource. You can go to it yourself and read it. The juxtaposition, and this is what Russell Brand goes into, stay tuned for that. You're going to be blown away by his dominion over this topic. It just blows me away. Anyway, the juxtaposition between dramatically increasing payments to private insurance plans that provide less care for higher cost on the one hand, and keeping seniors' premiums artificially inflated on the other, underscores the Biden administration's conflicting commitments when it comes to Medicare. So they're keeping your money and they're paying more of your money to the industry for next year, and they're not giving your money back to you yet. So here's my prediction, and I think this is what's going to happen. Just me to you, just from being an outsider, an observer of policy as it comes to Medicare, because Medicare is all I care about. Here's what's going to happen. The midterms are going to get here, and right before you go to vote, watch this and prove me wrong. Right before you go to vote, the government, I won't even say who that makes the decision, but the government's going to come out and say, guess what, seniors, I'm going to do you a solid. I'm going to give you, they won't say your money back. They're going to say the government's going to bless you with lowering your Part B for next year. Things have been so hard, it's your money anyway. Things have been so hard, we're going to return some of your, no, they're going to say, we're going to do us a solid for all of seniors because we care about them more than anybody else. We're going to lower the Part B premiums for next year. And that announcement will be ironically tied to the midterm election. Just watch for it. Here's the part that my agent friends are going to completely lose their mind over. This is the maximum broker compensation. This is what brokers make if they sell the plan on their own and not working under an agency. So this is the full commission that you would get if you're selling a Medicare Advantage plan next year. And for my agent friends who are watching, which I know a lot of them do, if you hadn't heard yet, and you're all focused on Medicare Advantage, congratulations, you're going to get about 5% raise next year for doing the same thing that you did last year, which is push Medicare Advantage plans. The Medicare Advantage plans are good for some people. There's not one plan good for everybody, and we do represent those plans, but we do it in a different way. We do it in full transparency by telling everybody what they're getting involved in and then patting the back end so that you're not completely exposed to only the Medicare Advantage plan. See, if you get a plan and you get the right ancillary things behind it to prop up those areas of concern that we have, you're a lot better off than just having a Medicare Advantage plan with $6,000 or $7,000 or $10,000 max out of pocket and saying you're patted on the head, you got a zero premium plan, go forth and prosper. No, there are some huge pitfalls that if your agent's not honest enough to tell you about, can really leave you very poor with paying all your bank account out to a plan that you thought, oh my God, I thought this plan, you replaced Medicare. The agents will sell it by saying it has to be just as good as Medicare, but we add all these free things. That is a lie from the pit of hell, folks. There's not a free lunch out there. There are some give and takes, and we'll be honest and tell you about what those are if you're going to consider a Medicare Advantage plan, so that you're not just beholden to just somebody getting a signature and then running off to the bank. Here's what they do at the bank now. So this year, nationally, some few exceptions here, and I'll go deep into this so you can see the difference. What do we make if we sell a supplement versus if we sell a Medicare Advantage plan? Now, if somebody's all into profit, if you hear from an insurance agent that they're only going to show you Medicare Advantage plans, this is why. This is what you need to look at right here. Nationally, if I sell somebody turning 65, brand new to Medicare, a Medicare Advantage plan next year, I'm going to walk away with $601. $600 for zero premium plan. How can that be? Taxpayer funded. K Street lobbyists pushing more money into privatizing Medicare. $600 I walk away with for getting you to simply say yes. And if you're doing it telephonically on the phone, just say, I agree, and boom, I get $600 for doing that. Now, during a typical Medicare season, we might enroll 500 people. Multiply 500 times 600. That's a lot of money for a season of Medicare. Okay, so it's different in different regions, right? What if you live in Connecticut, Pennsylvania, or Washington, D.C.? Then I would have made $678 next year for signing you up to a Medicare Advantage plan for your first time. Or if you're in California or New Jersey, because costs are just so much better there, I would make $750. So if you live in California, New Jersey, Connecticut, Pennsylvania, and DC, you are being hammered to get into Medicare Advantage. Why? This is why. Because the profit incentive is huge. Now, I hope you're asking the question, as you typically should. Yeah, but Chris, what's in it for you if you're telling people about Medicare supplements being better? With no network, with no prior authorization, with no restrictions whatsoever. Go to any doctor, any hospital, coast to coast, across the country that accepts Medicare. What's the difference for you? I'm glad you asked that because I want to share it with you. So let me go over here to the other one. On the top, I took out California, New Jersey, right? Let's look at New Jersey. The zip code 07305. I asked Google, what is a zip code in New Jersey? Now, by the way, let me pause for just a second. If you have a question on this stuff, type it into the comments on the YouTube channel right now. Because if you do, I'll try to answer it for you and bring it into the live stream before we end today. Then I'll go into the Russell Brand video. So Medicare Advantage, I would make $750 for a person brand new to Medicare, up 4.9% from last year. But if I sold that same person a Medicare supplement plan, leaving their original Medicare alone so that they're not leaving the roles of Medicare. They don't have a different insurance card. They've got their red, white, and blue card that they earn their whole lives. And they've got the freedom and flexibility that comes with original Medicare. without all the caveats or getting somebody's permission before you get treated. So what happens then? Well, the average commission for a Medicare supplement insurance agent could be a lot less than this if you work under somebody else, but it's 22% of the premium. So this is a random zip code picked by Google, and I'm looking at the lowest premium amount. This happened to be with Manhattan Life, a company that we know across the country is really good on rates and all that. This is the lowest premium. If you're going with another brand name, like a big name insurance company, you're going to pay more than this. And those agents writing those plans are going to make more commission because you make more commission based on more profit, more premium, right? Most agents in the country that are selling Medicare supplement plans are pushing Plan G for two primary reasons. I won't get deep into this. Plan G is very simple to explain, so that saves us time in the sales presentation. Very, very simple. Everything's covered. Go anywhere you want. Everything's covered. Small deductible, you're on your way. Okay, that's a Plan G explanation. And by the way, if I sell a Plan G to this same person, 65-year-old and 07305, I'm going to make $347 commission on that first enrollment. My first year commission is going to be $347. Now that's a far difference, isn't it? About half of what I would have made if I signed them up on a free plan in quotes, Medicare Advantage plan. So this person's going to be paying a premium here of just over $100, brand new into Medicare, for a Plan G. Now, these rates are different depending on where you are in the country. I just picked New Jersey, and the rates are dependent on your zip code, your age, and your sex, and whether you're a smoker or not. They vary greatly around the country. We've got the quote engine to show you exactly what those rates are everywhere. So Plan G is going to pay me, the agent, $347 that first year. But if I was an agent that actually took the time to listen, like our agents are in my office, we might find, as we do in most cases, that Plan N is the better fit for you for a variety of reasons. If you want to know more about that, make sure to look at plannmedicare.org. If you've had an agent, I'm looking for the link here so I can show you. If you've had an agent in your past that showed you only Plan G as a Medicare supplement, there's a problem with that. It might be that there's an incentive there. Is it .com or .org? I think it's .org. Make sure. Plan N Medicare. Yep, it's .org. So plannmedicare.org would be the site where you can see what is Plan N, how does it work, and all that kind of stuff. You can go there and research it. It may be a better fit for you for not only today's premium, because it's about 30% less premium than Plan G, but also the rate increases are drastically less every year. As things are going up faster and faster, Plan N rates and rate increases across the country are trending 0 to 3% rate increases. And that'll blow you away if you've been on Plan G and you've seen what that plan's been doing. Much worse if you've been on Plan F and somebody just left you there. So Plan N is probably should be considered by a majority of people. We know the questions to ask to see if that's appropriate for you. The point is most agents will not even ask those questions, much less take the time to explain how Plan N works. You can see it in the privacy of your own home by going to that website right there. I digress. If I write Plan N, that we do majority of the time, we're making $259 a year on that same client. Now, my next door neighbor who only sells Medicare Advantage plans never even presents Medicare supplement as an option, which is the vast majority of insurance agents, especially those under 50 right now that are in the industry. It's not an age thing. It's just all they're being taught. It's all the agencies are recruiting to, because the incentive on the agency is even higher than this. It's huge. $750 for my neighbor friend for signing you up on that free plan, or $259 for my agent's work on signing you up for a Plan N. This is an incentive that's insidious. It's horrible. What is the actual difference? I'm glad you asked. I showed you that here. The difference is $490 per person. This is an average. This is one example. Signing up somebody in their first year for Medicare Advantage commission versus a Plan N. $490. That's almost $500. Multiply that times 10 or 20 or 30 people you're helping a day in your office. The profits add up. That's why most all of my competitors have moved exclusively into Medicare Advantage marketing. This is why. Can you imagine $500 extra per client? How much further they're going off in their profit return of investment for reaching out to people? It's incredible. So I'm happy though, because I can sleep well at night by explaining all of this and all the options to our people who call in. And I know we're one of the few people left in the country that are actually doing this. And nobody's showing you this right here. So let's look at one more example. That was New Jersey. You might say, well, New Jersey pays the most commission in the country. Okay, let's look at South Carolina, which doesn't. South Carolina is just doing the original national plan based on $601 next year. Also almost a 5% rate increase there. $601 if I enroll a 65-year-old person, or if she's 70 or 75, doesn't matter. I'm getting $600 my first year on that person. On my plan in that I would write her, I would be making, this is the least expensive plan in this area, $197.70. Or I'd make a, what is that, 35% more, roughly 35% more if I wrote a plan G and save the whole thing of the explanation of what plan N is. I don't even talk about plan N, as most agents that do supplements don't. So I'll make a lot more money, 30 to 35% more, because again, they're 30% higher in premium. Insurance agents make a commission based on what the premium is if you're writing a supplement plan. So if your agent's only explaining you one thing and it happens to be the highest price thing, guess what? They just gave themselves a raise. Plan N is harder to do because it takes some explanation, but it's much better in the long term. So what's the difference here in South Carolina for a 65-year-old female? $403. It's not the $500 in New Jersey, but it's just as good. $403 more per person for that first year on the different plan. That's crazy. And you might say as an agent, yeah, but in future years, you don't make the same thing as the first year. Future years, you make less on Advantage plan. Okay, you're making 301. Or in New Jersey, you're making, I forgot what that was, 301 in South Carolina versus 197. That's still over $100 difference every year for that same person. It's crazy. So here's something else that's happening in the news, and we're almost done. I'm going to get to your questions. If you've had any questions, please put them in the comments on the YouTube channel now. We'll get to the Russell Brand video in just a minute. You don't want to miss that. Medicare Advantage just announced for agents a permanent rule that's going to be enforced for the new upcoming Medicare season. That's another difference between Medicare Advantage and Medicare Supplement. On Medicare Advantage, you can only sign up for those plans once a year during the annual enrollment period. And that's why it'll be all over the television soon, about August, September, all about Medicare Advantage. And you'll see these knuckleheads right here, Joe Namath and Jimmy, JJ, whatever Walker, and my old friend Bill Shatner that I really love from Star Trek days. What was that cop show that he used to be on? It was really, really corny, really bad. But anyway, I used to like him a lot. New rule comes out for this year that affects all insurance agents. And if your insurance agent is not following this rule, they're going to get in lots of trouble this year. This rule came as a direct result of massive amounts of complaints from this past year on seniors who did not have a clue what they were signing up for when they called these jokers' offices right here. I know they're just paid pitchmen and they don't have that, they wouldn't be near a plan that they're selling. But because of thousands, tens of thousands of complaints to Medicare because of those plans, if an agent is going to sell you one of those plans for the new coming year and for evermore going forward, they have to record their phone call with you. Why? Because Medicare enforcement wants to know what kind of lies and stories you were told when you were signed up for that plan. This will root out lots and lots of fraud in our industry. Those people who got signed up on a plan, they're like, how did I get on this plan? They call Medicare and say, they enrolled me in this plan. I don't want to be on this plan. It happens all the time. Now Medicare is going to go back to whoever signed that person up and say, I want to hear that recording of the call. And they better do things right by explaining all the things they're supposed to do, like the limitations on the network, like you have to go to the same doctor for everything, and your doctor can leave the network anytime they want to. The disclosures they should have been doing at these massive call centers, but they've not been doing, and it's been leaving a lot of people hurt. And Medicare has to clean up all that mess. So for now going forward, part of the new rule for 2023 is they must record all phone calls and turn them over to Medicare and keep them for an indefinite period of time in case somebody does make a complaint. This is great. This is going to clean up a lot of junk and trash in our industry right now that's been going on. Also, they're not allowed to have the microtype like they have. When you see the small print, when they start telling you all these amazing benefits that you could qualify for Even though last year, literally one of these guys was talking about all the benefits that you could get, rides to your doctor, free meals, air conditioning in your house, all kinds of, a robotic pet to live in your house with you. All those things that they were describing existed in one county in Florida. Oh yeah, the Medicare give back and the free card that'll buy you all this stuff. One county in Florida. It was enough, the lawyers told them, I'm sure, that if we can say they could get all these benefits, hey, it's possible. You know, if they live in that one county in Florida, they could get all these amazing benefits. However, for 99.9% of the rest of America, let's just tease it out there to make them call in and find out what amazing benefits they're entitled to. Tell them anything you have to get them to sign up over that phone call. Well, that's going to be changing. So the microtype that they put, that the lawyers make them put super tiny on the screen, cannot be less than a certain font size going forward. So after October, they were supposed to clean this up last year. They came out with a threatening memo. They never did anything about it. That's hopefully going to change. But guess what's changing with Medicare supplements? Nothing. Why? Because there's no fraud going on with Medicare supplements. Nobody's alleging that they're going to get all these amazing, wonderful benefits. No. Medicare supplement just supplements Medicare. A Medigap plan fills in the gaps of Medicare. Medicare says it's approved. The supplement pays it. There's no supplement that can say, wait a minute, we're not going to pay that claim. If Medicare says it's approved, the supplement pays it automatically. There's not even a decision maker in that process. It's just automatically paid through a program called Crossover up at Medicare. Medicare sees that your secondary is whoever it is, Aetna, Mutual of Omaha, whatever, and they send it over to them and they pay it. That's how simple the difference is. The distinction between we've got to really police this part of the industry, making rules that hold agents accountable for the kind of stuff that's going on, the shenanigans, or, yep, doing just fine. That should tell you something. And then there's this article that I've alluded to before. It came out last month from MedPage Today. Says a study shows that Medicare beneficiaries need help navigating the program. Many are aware of the penalties and exclusions and doing things on their own. So I would just say, since this is a big problem, call somebody you can trust to go over all the plans. It doesn't cost you anything to use an agent, just like with your homeowner's insurance or your car insurance. It doesn't cost you anything to use the services of an agent that actually cares what they're doing. We get lots and lots of referrals in here. My wife, Nicole, takes care of sending out thank you cards to everybody that sends us a referral. So if you do refer people to us, make sure you're letting them know to mention your name when you refer people into our agency, because Nicole wants to send you a thank you card and she handwrites them every day. It's a lot of work, but she loves doing it and reaching out to people personally. So we get a lot of referrals because we're doing things the right way. Even if you have a Medicare supplement plan right now and you're fine and you've listened to these things, and we have over 4 million, almost 5 million views on YouTube, congratulations. If you didn't let us help you with it, let us help you now by looking at it. Why? Medicare supplements change their rate usually on the policy anniversary. Whatever time of year you signed up originally, they're going to give you another rate increase. Some of the companies we work with, for a reason, are actually giving rate decreases right now. They're giving money back to people that are on those plans. So what you may not be aware of, if you've not shopped your Medicare supplement plan in, let's say, 2 years or more, we save people $80 to $100 a month all the time in here. So if you're on a plan G, that's great. You might be on the right plan for you, but you might be with the wrong company paying too stinking much money for it. It's the same plan. If you've already met your deductible with Medicare, it stays Medi-ready. You don't have to meet that again, because that deductible is not with an insurance company, which with Medicare. I encourage you, as things are going through the roof, gas prices are crazy, food prices are crazy. If we can be one of those lights in your life that gives you back $100 a month because you've been sitting on the same plan, just letting them do that to you over and over and over again. Now, can everybody qualify to get on a lower price plan? No. And I explain that, and there's a link here that I'll give you that I explain exactly how that process works. It's this one right here. If you go to this website, there's a video explaining how the underwriting process works. And most states, except for, and I'll probably miss one here, California, Washington State, Oregon, Missouri, Illinois, Nevada, New York, those states have special rules that allow you to go through without underwriting. You can change plans at certain times and certain conditions. We know all those rules, and you can get with us on that. But in the majority of the country, you have to go through underwriting. What's involved in that? What are the questions like? I go through that in detail at this link that you can see online. It's our website, seniorssavingsnetwork.org with the /underwritten. You can see everything right there that would be involved in making this decision. So you don't have, and it doesn't cost anything to apply for a lower expensive plan, least expensive that's out there for you. So I encourage you, go for it. See if there's money there for you. If you know somebody else that's on a Medicare supplement, and again, you can change your supplement any time of the year. It has nothing to do with the Medicare season. That's all Medicare Advantage stuff. So I encourage you now during June, July, August, September, any other time of the year besides October to December when everybody's focused on Medicare Advantage and drug plans, the rest of the year is the best possible time. And we've got a team here that does nothing but underwritten cases. Many agents out there just chase people that are turning 65. I get it. It's simple. You're in your initial open enrollment period. You can do anything you want to without underwriting with a Medicare supplement. That's your one chance to do it without any health questions. But how many agents are willing to go through the questions with you, find out about your particular situation, and find out if they can save you money and go through that process with you? It may take 30 minutes out of your life, but guess what? It doesn't cost you anything to apply, and we do it all over the phone. Nobody has to come see you in your house. Please share that with somebody that it might help. That's all I got to say about that. Now, watch this. Wanted to see if there's any questions real fast. Let's see. TJ Hooker, that was the name. Thank you so much, Ron, for telling me that. And somebody asked if we do Iowa. Yes, we do Iowa. Thank you for the nice things y'all are saying. Carol said, Plan N makes you pay copays. I switched to Plan G. Great. If you add up how many copays you're going to have versus how much you're paying on Plan G, it's probably about 10 to 12 visits a year you'd have to do for making Plan G work, and then multiply. If you're going to be on Medicare for the next 5 years, what does a compounding 12% rate increase look like 5 years in? For most people, that's unaffordable. So you have to factor that in too. Here's your Plan N. Here's your Plan G. Tell me how long that's affordable. And your option to change expires as soon as you have a chronic condition or chronic illness or a major significant health event. Then you can't go back to the plan that's going to save you money over the lifetime of being on Medicare. But yes, it has copays. Can you go from Plan F to Plan N without underwriting if you have health issues? It depends on where you live. But I cover that again at the website that talks about what those options are. And it's seniorssavingsnetwork.org/underwritten. I encourage you to go there. Bill says, I got Plan N, very happy with it. Thank you. Yeah, we do help almost all states. I'm licensed in Hawaii, and I'm not sure about Alaska, if we picked up Alaska, but most everywhere else. Great. Oh, thank you, Patty. Almost 1 year in. That's great. Just a couple more questions I'll get through here. Is the supplement and Medigap the same? Yes, there's just different terminology for it. And John asked, is underwriting required to go to a different company? Yes. If you're in a state that has underwriting, and I cover those on that website, and I just listed all of those here. For the majority of states, yes, to go to a different plan or a different company, there are health questions. And a whole bunch of nice things in here. I really appreciate that. Lisa, don't be scared. Just give us a call, or just go to seniorssavingsnetwork.org and click on Medicare help at the top. And if you want to know how to get started on Medicare, where to apply, when to apply, and all that, you can go to a website that I made that makes that so easy, called howtostartmedicare.com. Pretty neat, huh? It's not the best video in the world. I shot that during COVID, but everything's still relevant there. Howtostartmedicare.com will answer those questions and make you feel peace of mind that you know you're doing the right thing. And when you can see all the options, then you know that you've exhausted all your research by letting us do the research for you. Or you could get your insurance license and do it yourself, but I don't really suggest doing that. Thanks, Bill, for the referral. We really appreciate that. Thank you, Karen, for being here. All right, now let me get to this video, which will blow you away, and then I'll conclude. Again, if there's anything that we can do for you, please reach out. Our website's there 24 hours a day answering questions for people. Of course, this YouTube channel has over 300 videos that help answer questions that people have. Please share this resource with people. Really appreciate it if you do that. And here's that video. God bless you, and we'll see you all on the other side.
This is from the lever. Last week, the Biden administration quietly reaffirmed its decision to enact the highest Medicare premium hikes in history right before this year's midterm elections. Is that a good time to do it? At the same time, President Joe Biden is endorsing a plan to funnel significantly more Medicare money to insurance companies and further privatize the government insurance program for older Americans and those with disabilities. Let's get those vulnerable people properly monetized. In effect, the higher premium increases will subsidize the larger payments to and profits for private insurance corporations. Have you got this terrible concern that during this time of suffering and price hikes, that the most powerful interests in the world are doing quite well? That's why I sometimes feel that these crises are not universally felt and why they're allowed to continue. Because what I experience as crisis to ordinary people are times of great advantage and boon to the most powerful interests in the world. The administration's announcement comes as Biden officials move forward with a jolting 8.5% hike in payments made to private insurers operating Medicare Advantage plans next year. The juxtaposition between dramatically increasing payments to private insurance plans that provide less care for higher costs on one hand and keeping seniors' premiums artificially inflated on the other underscores the Biden administration's conflicting commitments when it comes to Medicare. Since taking office, Biden has expanded Medicare privatization by launching the involuntary ACO REACH program and through continuing to promote ever-increasing Medicare Advantage enrollment, and he has also raised premiums for Medicare recipients. The result, advocates say, is a situation in which Medicare's sturdiness as an American institution is being steadily chipped away by well-connected corporate interests. The privatization effort is reaching a frantic state, and Medicare Advantage is going to fail, said 𝗍𝗂𝗿, president of the American Retirees Education Foundation, due to the fact that the plans must pay profits to investors, unlike traditional Medicare plans. The industry is hoping to cover up that failure with taxpayer subsidies, and none of the taxpayers understand. Isn't it interesting, really, that you have to obscure reality in order to conduct political business, that most people don't understand that these subsidies are being indirectly paid, and it also highlights the impropriety of medicine being privately funded in this way. You know that at some point in your life you will become sick, and of course your death, as well as the death of everybody that we love, is inevitable. And yet we continue to treat sickness in the abstract and allow it to be the domain of some of the most corrupted and powerful interests in the world. All Medicare recipients pay premiums for outpatient care, which is called Medicare Part B. That money can be funneled into traditional government Medicare plans or into Medicare Advantage plans run by private insurers that are incentivized to limit the amount of care that elders receive. If you make the administration of healthcare and medicine a privatized interest that necessarily operates for profit, it means that they will have to reduce services in order to generate profit. In a way, it's obvious that this problem will occur as soon as you make the decision to privatize healthcare. It seems to me the only way that you can make healthcare effective is to entirely remove the profit motive. How would this negatively impact you if it became a service that was based on compassion and pragmatism rather than centralizing funds, taking taxpayer dollars and placing them into private hands? How would it affect you negatively as an ordinary American? The standard Part B premium for Medicare patients is now $170 per month, up 14.5% from last year when it was $148. Half of the increase in premiums came from a single drug, Aduhelm, which despite its June 2021 approval from the FDA to treat Alzheimer's disease is not proven to do so. This drug treats Alzheimer's. Does it? We can't prove that it does. We just hope it does because we want to sell you it for this amount of money. Sorry, what did you just say? In June 2021, Biden's FDA approved the drug Aduhelm for treatment of Alzheimer's, despite controversy involving alleged scientific disputes inside the agency over the drug's efficacy and industry pressure on the internal review process. When there's an internal dispute within the FDA about a drug's efficacy, what decision will ultimately be taken? The one that leads to profits, because as you know, the FDA is 45% funded by the companies that it regulates. In a sense, the entire system is built to generate the kind of challenges and problems that are being demonstrated here. So who benefits from the explosive rate increase? the major private insurance companies that helped bankroll Biden's 2020 presidential campaign. Medicare Advantage insurers such as 𝗦𝗲𝗋𝗆, Anthem and CVS Aetna are celebrating record profits in the tens of billions of dollars, said Dr. Susan Rogers, president of Physicians for a National Healthcare Program. Their business plan is simple. Inflate their Medicare payments by making seniors look sicker than they are, then pocket more of those Medicare dollars by ruthlessly denying seniors care. These seniors are very, very sick. We're going to need a lot more money. You're going to have to supplement it. Won't be able to afford to treat them. Oh, yeah, no, you're right. We don't want loads of old people sick, especially the president's really, really old. He's going to need the help at some point. Go on then, give us the money. Right, out them seniors. We're not giving them that money. We need that for the profits. That's a proper racket, isn't it? You artificially inflate the price and then you do not deliver the implicit service. Meanwhile, more than 7 million seniors live in poverty and 7.3 million seniors are food insecure.
Pretty crazy. Y'all have a wonderful day. If there's anything we can do for you, please reach out and let us know. We'll be here. Thanks. And the links will be under this video. Take care.